Thank you, Rona. The question on everybody's mind is about the aid that the Western powers are threatening to cut that comes to Uganda, that has been coming to Uganda. The president recently has said that in case the aid is cut, as Ugandans, we shall discipline ourselves in terms of expenditure. I'm joined with Honorable Batuwa Timothy as we delve into this topic. Honorable Batuwa, you are welcome. Honorable Batuwa is the Shadow Minister for Health, and I am sure this aid has been mainly going to the health sector. Honorable Batuwa, will the President's proposal of cutting down on expenses bridge the gap with the aid that has been coming to Uganda?
Thank you very much. In regard to the aid that has been coming to the health sector in Uganda to improve service delivery from the developed countries, which aid is now about to be cut because of the move the country took by way of legislating the Anti-Homosexuality Act. It will affect the country significantly. When you look at the health sector, last year we funded it to a tune in excess of 3 trillion shillings. And this aid we are talking about is about $1 billion US. So that comes to 3.6 or 3.5 or 3.7 trillion Ugandan shillings. So when you look at it, health should run at a budget of about 6.5 trillion shillings. Of that, we are contributing half, and the development partners are contributing the other half, though they target their half that they are contributing to particular programs, namely HIV/AIDS, malaria, TB, and system strengthening. So they've put it in areas where the country can really feel it. Malaria is the biggest disease burden. We lose so many Ugandans due to malaria. HIV has brought the country to its knees. It has affected the rich, the poor, the powerful. It has affected everybody. And then the systems had collapsed. Our systems in healthcare, service delivery had collapsed. The staffing levels are extremely low. Whereas WHO recommends at worst to have a staffing level of 65%, we have 33% in prominent healthcare facilities like national referrals. A case in point, a Kawempe National Referral Hospital, a specialty hospital that deals with women, having a staffing level in the 30s, yet the recommended minimum, the worst, should be 65. That gives you an impression of where we need to be and how this donor money is helping us strengthen the systems. So there are people who are on their payroll who are giving a service in this area. So when they pull out, we shall feel it significantly because they've put money where it matters most, where it is very visible, where it can be felt.
Honorable, you don't think that if we cut down on the expenses, like the government expenditure, the public expenditure, we cannot put that money to use, especially in the health sector that is going to be greatly affected when this happens, in case this is affected?
Yeah, I've had an opportunity to be in Parliament, and this has given me a wonderful exposure, sitting on committees and getting to know the priorities that government funds. But we have a characteristic list called the Unfunded Priorities. When you look at that list, priorities that are not funded, then it limits your prospects of cutting down on expenditure, because we have a list of items that should actually receive money. Like, for example, in this budget process that we've just concluded, Red Cross had a budget that should have run it in the coming, that should be running it in the coming financial year, but it was cut by 80%, 80%. But now look at Red Cross and the activities they do, whether it's a landslide, whether it is a big accident or what, you will always see the ambulances there. This is an institution where an ambulance will be brought and the sick or those ones that are injured are rushed to the hospitals without asking for money for fuel, without delay. But such an important institution, having its budget cut by 80%, and again believing that you can do further cuts. Now where will you do further cuts? We are discussing interns and senior house officers. These are medical people, the doctors who are handling referral hospitals mainly. These don't get a salary. Their welfare is managed on an allowance. And in this particular budget, the allowance wasn't provided for. So if you've cut the allowances, what other further cutting can you do? So we are on the brink. We can't do any further cutting. There isn't any money that we are spending casually. So, you know, we are on the limit. We are on the extreme limit. What can be done at the moment is to fast track the National Health Insurance Scheme, but still it can't cover the gap, because if you're to look for 3 trillion, much as the donors have been giving us in excess of 3 trillion, but if you're to look for 3 trillion, you will need at least 15 million Ugandans to pay 200,000 shillings. It is simple on paper, but very hard to implement. You can look at it in comparison with the NSSF. NSSF, the total number of contributors who are contributing mandatory contributors are about 1 million, 900,000 to 1 million. And these are the mandatory ones. But we need 15 million. We need 15 million. So if NSSF can raise up to 1 million, how hard will it be to look and fetch for another 15 million out of Uganda? So it's quite difficult. And if it's to be voluntary, that whoever wishes to contribute to the National Health Insurance Scheme should contribute. If I'm to look at NSSF and fish out the extent they've gone in soliciting for voluntary contributors, as per 2022 International Labour Organization data, it indicates that the voluntary contributors in NSSF are 31,000. So if we are to leave the National Health Insurance Scheme to be a voluntary activity, we can only manage to fish around the same 30,000, maybe up to 50. But you know, this gives you an indication of the number of people who are likely to subscribe if it's voluntary. And if they are to pay 200,000, you will fetch only 6 billion. But you're in a scenario where you need to look for 3 trillion Ugandan shillings. So it's an uphill task. If you're to force them and you're to push hard, NSSF is indicating to us that the most we can go is 1 million. Meaning if somebody pushes hard and gathers 2 million, that one has surpassed and has overperformed. So the 2 million paying 200,000, that comes to very little money. You get it? That comes to very little money. So basically, it comes to 4 billion. So basically, what we are looking at here is theoretical, is imaginary. It is better to sit and iron out these issues diplomatically, because in the first place, what inspired the development partners to come to Uganda and give us aid, and most especially aid in that form, I think those factors are still subsisting. They didn't come because Uganda had opened up to homosexuality. That has never been the case. So there is a reason as to why they came. So we should use our diplomatic skill, and this is the reason why we need the right people in the right positions. We should have vacated the idea of rewarding loyalists, having cadres in positions that command authority, that command power. We need to have diplomats who should be diplomats on merit, not people being rewarded because of their loyalty, not cadres being given ambassadorial positions. A diplomat would sit down and try to find out a diplomatic approach that can really, solve this situation. More than what has prevailed in the homosexuality, actually, the country and many citizens thought we never had a law to regulate or to limit or to prohibit homosexuality. The law was there, the law existed, but the situation was handled as though there wasn't any, and it excited everybody, including the development partners. So that act of bringing another law when one is already existing, and yet this aid was given to us at a time when we still had a homosexuality law. You get it? So we lost it diplomatically. We just lost the fight diplomatically.
Honorable, if we are to take the president's side of cutting down on expenses, where should we start from? Where can we start from? Because we know there's excessive public spending, which is costing the country.
Yeah, the biggest sector that really takes money is the classified budget. And classified means they can't tell us what they buy. But we justify classified because we know it is to do with security, and the security of the country should be handled in such a manner that our enemies don't get to know how weak we are or how strong we are, such that they keep respecting us the way they've always been doing. But now that we are not at war, it's important that we cut on the classified budget. The other area where we could also get money is how quick we can start exploiting the mineral resource of this country. We know and we hear that we have gold. We see gold mining activities being done in various districts of the country, but being done casually by casual people. So how quick can our country take it on as a state activity? How quick can we convert the fuel that we have into money? Of course, we are waiting for the pipeline to be constructed, but in the meantime, can we ferry it, using the roads? Even if we are to commit 5,000 trucks or 6,000 trucks to do that work, so that on each day, about 2,000 can ferry several barrels. So as the 2,000 go, the 2,000 are waiting to load, and another 2,000 are waiting to be loaded after the second 2,000, so that we form a circuit. You get it. As the other ones offload, they come and reload. So how quick can we convert fuel, that oil that we have, into money? And this is the real area where our reasoning and hope should be. When we start talking in terms of budget cuts, it's not visible, because even the classified budget that we are talking about, it is very important. Security, sovereignty of a country is very important, and it's not just important on paper, but you have to have the strength to protect the country. Strength is in terms of weapons, it's in terms of the people. They have to be trained, they have to be healthy, they have to be motivated. You get it. So I really don't think Uganda is a country that can do any more budget cuts. It has so little, it has overcut. Most of the sectors have underfunded and unfunded, unfunded priorities. And what is funded is actually underfunded. So my hope is in the God-given wealth, the resources that are beneath the ground. Specifically the gold, which President Museveni, in one of the State of Nation address, happened to say that our worth of gold is 12 trillion US dollars. What we have is 12 trillion US dollars. That is a lot of money. It can transform us into a first world country overnight, you see. So let's put all the thinking in that, even if it means getting maybe an outstanding multinational company, a private company that is really doing this kind of mining, and we give it reality, fetch this money. That's what we have to do, but there isn't any thinking that can go beyond that prospect.
Honorable, don't you think now in such a case, if this is affected if the aid is cut? Do you think government is going to think of more bringing more types of taxes to tax Ugandans who are already being taxed a lot?
No, taxes can't be increased limitlessly, because at a particular point, issues of compliance come in. So if you raise the tax, you reduce the compliance, most people default. A case in point, the borders have a permit to pay. It's not a tax, it's under the Road Traffic Act. There is a permit that they should pay. That license goes for about 200 to 300,000, 100,000. No, it goes for about 200,000. But it has conditions that before you pay for it, you need to be examined, and the cost of examination is also in the schedule, about 100,000. Then before examination, your vehicle, your bike has to also be inspected, and the cost of inspection is also in the schedule. It's in the act. Now, when you put all that together, these people part with 500,000 just to get a permit. Now, 500,000 is not affordable. Consequently, these people are not paying. That's why whenever there is an operation to get those that have not paid for the permit, almost everybody is rounded up. So this is an indication that you can't increase taxes limitlessly. The moment compliance comes in, then you will realize much less than you've been realizing. At the moment, we are really pushing beyond limits such that we collect 25 trillion. It's not easy. Even when we collect 25 trillion, what is due to debts, what we have to pay for the loans, is again so big that what is left is about 8 trillion, which is just enough for our recurrent budget. Recurrent is paying for salary. You're just paying for salary. You're paying for the daily operations, the fuel for these cars to move up and down, the maintenance, and all that. So for you to do development activities, for you to do investment activities like the way you need to do in agriculture, so that a country realizes more money in the coming financial year, it won't be possible. So our healthcare sector will also not be able to buy equipment because that's under the development.
So, Honorable, as we wrap up this, so in conclusion, Uganda cannot sustain itself without the support from the donor partners.
Uganda can only sustain itself if it gets the natural resources that are underneath and puts them on the market. So the earlier they can convert the oil into money, the earlier they can convert the gold into money, it is the moment they can now start sustaining health. Anything outside that is theoretical, is for the paper and for the speech. It will just be good English, but it will not be practical.
Thank you so much, Honorable Batuwa. That was Honorable Batuwa, who is the Shadow Minister for Health. You've heard it from him. The only way we can sustain ourselves as Uganda, we can sustain our budget, is if we make the resources into money. If we get the money from the resources that we have, that is the only way. Otherwise, we still need the donor support money as a country. Thank you so much.